Hello, this is Dr. David Green, Education Director for Premier Pain Specialists in Chicago. Today's topic, what you need to know about facet joint syndrome, also called facet joint arthritis. Well, what is the syndrome? Every level of the spine has two facet joints. They're about the size of a thumbnail. They do contain cartilage, left, right, okay? Cumulatively, they allow individuals a very impressive range of motion. Even though these joints are small, they can be a very impressive source of pain if arthritic. So the facet joint arthritis actually starts in the disc. Okay, the disc starts to degenerate, it loses water, it loses the ability to suck in the stresses that are seen. So it shifts those stresses to the back of the spine, so the facet joints start to see increased stresses, and that can cause degeneration. Okay? Why is facet arthritis more complicated than hip or knee arthritis? We don't have an effective facet replacement like we do the hip or the knee. Also, there are two facet joints at every spinal level. There's not just two total, like two hips, two knees, right? So there's over 40 facet joints. So even a small joint, such as the facet joint, can produce significant pain or none at all. Why do people develop facet syndrome? Most commonly, it's from degenerative wear and tear, osteoarthritis, okay? That's the most commonly. It can also be post-traumatic, such as from whiplash. Whiplash is thought to cause significant injury to one's facet joints in the neck. This can go on to cause post-traumatic arthritis and pain. And there's a genetic component which we don't understand very well. How is the problem diagnosed? History and physical exam can help. X-rays can be highly suggestive. You may have severe arthritis at a level, but you may be asymptomatic. So interventional procedures can be great. So they can be both diagnostic and therapeutic. A facet joint injection injects numbing medicine into the disc and maybe some steroid as well. A medial branch block actually injects things such as steroid and numbing medicine around the joint. Okay, it stops the transmission of pain signals from these medial branches, which are little nerve endings supplying the joint. No motor function at all in those nerve endings. Additional treatments for facet syndrome include over-the-counter medications, non-steroidal anti-inflammatories, and Tylenol. Short-term opiates for exacerbations. Prescription pain creams can be great. Physical therapy and chiropractic treatment for facet arthritis. TENS units, and then spinal decompression therapy, which involves computerized intermittent traction, which has been shown to be over 80% effective for facet syndrome and degenerative disc disease. Interventional treatments that are available, first and foremost, include the medial branch block. When you look at a facet joint here in this picture, you can see that there's little nerve endings coming down and coming up. Okay, this is a nerve root, and off of the nerve root comes the medial branches. Some go down to the lower facet joint, and some go up. All right. So when you do a medial branch block, you inject numbing medicine and maybe some steroid around the joint to stop the transmission of pain signals from these nerve endings. Injection right into the joint itself, a facet joint injection, can be very beneficial. If those are performed, work well, and then wear off, a radiofrequency ablation will actually deaden these nerve endings. So there's the facet joint injection, and there's the radiofrequency ablation. What was the typical outcome? Medial branch block has 85% effectiveness with an average pain relief for 3 to 4 months. Radiofrequency ablation is 80% excellent results for 6 to 18 months, and then you can repeat it with the expectation for the same outcome. All in all, over 95% of patients are able to achieve a satisfactory non-operative outcome with facet syndrome. The top non-operative pain management in Chicago is with Premier Pain Specialists. There are several clinics throughout the metro area accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-519-4701. Thank you very much for watching.